Rynell Nolan, President, CEO, Health Agents for America, coming to you live this Monday. I want to talk to you about Mystery on the Bayou. Doesn't that sound like fun? Our Mystery on the Bayou Agent Summit. Make sure that you save the date. Please go ahead and book your room. There's only 40 rooms on the property. We're going to have a fun event on Wednesday night, a wine and cheese reception with the speakers and sponsors, and then Thursday, a murder mystery party where everyone will come in costume if you choose, but you'll know exactly what role you're playing prior to the event. We are filing CE, and we'll be able to get those CEs for those who apply early. And if there's some reason that we cannot get CE for you, we will make sure to refund you for the CE course. So please make sure to save the date. It'll be, post-COVID, and we will adhere to the COVID regulations, whatever they may be, in August. And we'll have a good time. It'll be an opportunity for us to be away from the public and enjoy and learn a lot of things about all the things that's happening in our industry, and then there's a lot. I wanted to talk to you about one of the articles in the Monday Morning News about surprises in President Joe Biden's safety net proposal, American Families Plan. Something that didn't make it into the final version was any mention of reining in the cost of prescription drugs. We all know that continues to rise, and that is something that must be addressed. Congress is considering a drug pricing legislation to help pay for proposed infrastructure spending. Most Democrats agree it's time to tackle the high prices of drugs. Also, Senate Democrats are working on some drug price legislation. The real problem is what to do with the considerable budget savings that would be produced by policies like allowing Medicare to negotiate prices. That's something that pits the more liberal Democrat backers of Medicare for All insurance system against moderates who would instead put the savings in expanding the benefits of the ACA. On hearing reports that Biden's family plan would leave major health items on the cutting room floor, Medicare for All sponsor Senator Bernie Sanders and 16 Democrat-Republican colleagues urged Biden not just to include Medicare drug price negotiation authority in his package, but also use the proceeds to lower Medicaid eligibility age, a Biden campaign promise, and also add hearing, vision, and dental to Medicare for All. Not Medicare for All, sorry, to Medicare. Add dental, vision, and hearing to Medicare. More than 50 members of the new Democratic coalition, a more moderate group of the House Democrats, also wrote Biden, urging him to use the package to enhance the ACA. Lauren Alder, Associate Director of the USC Brookings Schaefer Initiative for Health Policy, said the obvious next step is to make the new ACA subsidies permanent. You've heard me talk about that. Basically, he said there are no deep-pocketed stakeholders like health insurance companies or drug companies who would step in to fight that plan. That's something that we may see that ends up being a permanent thing that also, as I continue to say, will affect the small group market under 50. You need to pay attention. We've heard a lot about the COVID-19 vaccine passports being, something of the future, that some countries are using that as proof of entry. I know I'm planning to attend a wedding in Anguilla, and one of the questions that was asked to me is if I'd had my vaccine. Not sure if that's going to be a requirement, but I know a lot of countries are thinking about that. What the U.S. is saying is, is that a privacy violation? And if you've worked anywhere near HIPAA or anything about getting claims data or anything else, it's always a privacy violation to ask those kind of questions. And it was very interesting because I work in this industry and I didn't even think about this, didn't even think twice. But one of my friends heard me repeat this and said, Ronell, that's a HIPAA violation. But I went to get a massage and for my mom for Mother's Day, and they said, if you show us proof of your vaccination, that you will not have to wear your mask. And what they did is they took their cell phones out and took a picture. They shouldn't be taking pictures of my vaccine card to keep in their records. So I should have been a little bit smarter and a lot more savvy. But as I continue to say, COVID does suck your brain out, and I'm waiting for those brain cells to come back in. Just a reminder, the deadline for filing taxes is May 17th. So those that don't remember May 17th. And also, I just got a little giggle out of a CMS update that I received that said agents and brokers are not allowed to file taxes for folks unless you have a tax preparer license. You can help with 1095s. Now, if I am talking to you today and you do not know you are not supposed to file taxes unless you have a license to file taxes or that's your expertise, okay, maybe I'm not supposed to giggle, but I'm saying I'm supposed to giggle because you should know better. And I think you do, but the House is tussling over a bill to let Medicare negotiate drug prices, and we talked about that a little bit earlier. Also, health insurers are accused of overestimating cost to reduce rebates. Now, even in our association, we've had deep discussions about the MLR rebates for years. And I have said, and not everybody agrees with me, and you don't have to, but I have said that I have testified alongside folks that have said, look, the MLR is 80-20 or 85-15 or whatever it is. Insurance companies can raise their expenses or prices to offset those amounts. This is exactly what they're saying in this Insurance News Net. So it wasn't me testifying to that. It was other people testifying to that. So it kind of just makes you think, is that possibility? I know there's rebates being paid and maybe they're not allowed to totally overcome that, but it's being talked about. The other thing I wanted to point out is I'm so excited that the Insurance News Net has asked me to do a webinar in July, actually the day before I fly out to Anguilla, talking about commission transparency and things like that. So as soon as we get the link, we're going to send that out so folks can join. The last one they did was with the president of NAHU, and this will be with the president CEO of HAFA. So very excited, very honored. I talked to Susan Roop a couple of Fridays ago about putting this together and would I be interested, and absolutely. By then I should know a little bit more about how this is going to work out. I'm still trying to meet with CMS while I'm in Washington. I haven't got any confirmation about a meeting, but you know that I'm going to continue to try and see if we can at least get an audience and talk about just some of our concerns. We know it's the law. We know it's the law of the land. We know it's not going to go away, but we want to interpret it correctly so we make sure that we can go ahead and start now preparing because we don't need to wait until December. We need to start having the conversations now. We need to start trying to collect the data that needs to be collected. This last week, for those that are friends with me or follow me on Facebook, it was the 4th anniversary of the passing of my brother. And last week has just been a horrible, horrible week. And, you know, grief doesn't just touch me, it touches so many of our members. And I wanted to ask you, if you pray, pray. If you can send good thoughts, send good thoughts. If you can send some virtual hugs, send some virtual hugs. I did find out that Michelle Kirkwood from Nevada lost her mother recently. I've lost a parent. I know how that hurts. So many of you have lost parents. You know how it hurts. And then I got an email from one of our long members who might have been a member since the beginning, Greg McCarter, who has been diagnosed with stage 4 liver and abdominal cancer. I had saw an email that somebody had asked for me to pray. I did not know it was our Steve Carter, and now I know, our Greg Carter. I know it is our Greg Carter. So please keep him in your thoughts and your prayers as he goes through this major, major struggle. If you're in Louisiana and you like drag racing, I don't like drag racing, but I think it's going to be funny and I'm going to go. It is a drag race of Louisiana legislators who all the funds and all the money is going towards recovery relief. So those affected in Lake Charles and different places that, and further up Louisiana, mid-Louisiana, those that were affected by the recent hurricanes, it's all the money's going to go to recovery. But if one of the legislators wanted to race, they can race. In a recent House Insurance Committee meeting, for those that know Representative Huval, who's been a HAFA, hero, the Chairman Brown said that he and another legislator was going to race in a foot race. Now that was a joke, but I said I will absolutely pay for that. And then at the recent Senate Insurance Committee meeting last week, I was laughing, saying that Chairman of the Senate Insurance Committee, Kirk Talbert, could race my car. My car is a very raceable car. And the president of the Big I said, that's not covered under your insurance. So we forgot about that. I told Chairman Talbert he could not race my my car. But if you know anything about New Orleans, and you've been in New Orleans and you've ate a Lucky Dog, Senator Talbert is the owner of Lucky Dogs, and I told him just to push his Lucky Dog cart, and he could race in that manner. I wanted to tell you about an article I read on the out-of-network billing. So balance billing, surprise billing, something we've talked about for years, that one of the biggest issues is with laboratory services, according to a new study of JAMA Internal Medicine. Very interesting that that's where some majority of this is coming from. And I did hear about this in a Louisiana Balance Billing Committee meeting not a committee meeting, a think tank that I was in, and they talked about the fact that if your lab is sent to the wrong laboratory, not out-of-network laboratory, you had no idea that some of these people are being billed like $5,000s and $10,000s of thousands of dollars because it went to the wrong place. And think about even you selling insurance. If you go to your doctor and they say, what lab should you use? You might know doctor, hospital, but we don't always think lab, and we need to be very, fine focused on lab and letting our clients know about lab. I want to talk again about CMS giving $80 million to the navigators, more money than they've ever given before. Now, I think it was last year where it was the Kaiser Foundation that did a report. Recently, there were Representative Buddy Carter testified about the navigators and the dollar amount that was used per navigator to enroll one policy was astronomical compared to what agents and brokers are paid, not by the federal government, but through insurance premiums that are already included in an insurance premium. So the federal government continues to throw money at a program that is defunct and does not work. So many of you reach out and say, how can I be a navigator? Well, the ACA, CMS, whoever made the law, and I think it was in the actual ACA law, that says you can't be an agent and broker and a navigator. Now, some people have reached out and said, at this point, it might be more advantageous to be a navigator than it is an agent and broker, and it might be. If there continues to be millions and millions of dollars being spent on these programs, and there's only a few navigators in a state, and all the millions of dollars are divided by those couple of people, it might very well be. I continue to tell the story about the navigator, and this was in the beginning, the navigator in Louisiana that drove the Porsche and had a Rolex. I promise you, I do not have a Rolex. Well, I lied. I have a Rolex, but it's fake. I have a fake Rolex, and my car is not a Porsche. I can promise you, it's a Toyota. Another thing that we're hearing a lot of bad information from insurance companies. Be careful, ask questions. They're releasing information about COBRA subsidies and different things that are just not correct. So if you see something squirrely that you don't think is correct, please send it to me. I got an email from Alaska, from Primera, that basically says if you do not get your tax credit now during the SEP, so you can go in, everybody knows you can go into your clients, you touch your clients, they automatically get their extra tax credit, or they can wait until the end of the year when they file taxes and they'll get it then. This from I'm saying it wrong, from Alaska, says that if they do not take this action, they will not receive additional tax credits they may qualify for. I highlighted it. It's wrong. It's absolutely wrong. I got the CMS press release and highlighted it and sent it over to our folks in Alaska so they can see and they can show that this is incorrect. I might have talked about this before, but I wanted to bring it to your attention again. CMS has adopted rules to lower the healthcare cost in 2022 to reduce the out-of-pocket cost by $400. I have reached out to insurance companies and I haven't heard back. And if you want to reach out to some insurance companies in your state and let me know what they say, I'd be interested to know, are they going to have to refile plans that are going to reduce all of their out-of-pockets by $400, because this is a change in their plan structure. So it's pretty huge. I know things are done on the federal level, and they don't think about the trickle down about what actually happens. But insurance companies have to make changes, and they are going to have to adjust all of their plans. In closing, we had a wonderful Zoom meeting with our legislative team. After our Power Hour was wonderful. Thanks SyncStream for doing a magnificent job about the ACA and employer changes and what you need to be aware of. Legislative team, we're working on each state that's in session right now, what we need to be aware of, what bills we need to be aware of, what we need to be for, against. So we had a really good meeting. I'm working on our minutes right now to get all that into our legislative liaison, our team's hands, so they can take a look. We're working with Georgia to get over to Georgia to do a meet and greet fundraiser for Shaw Blackman, Representative Blackman, who put together the commission, the legislation and law he passed to make sure that if insurance companies have commissions in their rates, they must pay commissions. So working really, really hard. I'll be in DC next week, and we'll be excited about our report. And then Absolutely. Last thing was in our Zoom call, on our legislative week call, we talked about going to Washington. If there's someone that would like to go to Washington, of course, it's on your dime, but I make all the appointments. I make sure we see important people. I make sure we work really, really hard. But if you'd like to go with us, please send me an email. I'm going to be sending out a couple of dates so we can lock down some dates and make sure we get something on the calendar. No, not murder. Murder sounds so good, but no. Mystery on the Bayou. Save the date. Until next Monday, have a wonderful day and a wonderful week. Proud and honored to represent the HAFA freedom fighters, the cream of the crop, the best of the best. Love you all. Ronell Nolan.